So on the day of the surgery, they'll arrive and they'll meet our operating room nurse, and she will start the patient's IV, she'll get them checked in, and then I will usually go in and speak with the patient. We'll review exactly what our plans are for the day, for the procedure. We'll go through that in detail, give the patient more opportunity to ask questions about what's going to happen if they have any. And then a lot of times I need to do markings. A lot of what I do with the face and the breast and the body requires some very detailed markings so that it can be our guideline and our roadmap, if you will, for what we're going to be doing. And that's another good opportunity, of course, for us to be able to verify exactly what our plans are so that there's no confusion in the mind of the patient. Then our anesthesia person will come in and discuss the plans for the anesthesia. After that, of course, they're going to feel much, much better about the anesthesia part. I do find that is oftentimes one of those things that patients are very apprehensive about. So following the surgery, then they're placed into our recovery room. My recovery room nurses are very, very experienced. They're handpicked because of their expertise and their compassion. And as the patient emerges from that anesthesia, then we can bring the caregiver or the family member back to join them. That's another opportunity for us to work with the caregiver and the patient's family to give them those very critical and specific instructions that they need to know in order for us to get a good outcome. Again, having done this for almost 20 years, we've really refined based on what we know works well from science, from our experience, and again, from learning from the patients, what's really going to help enhance their recovery.